I would like to continue now. The next speaker is Elke Schindler. Elke is medical director of the hospital in Villach. We have been in contact many times. And before she became the medical director, she was working in the hygiene team and in the quality management team of the hospital. And before that, she was an anesthetist and intensive care physician. So she has a very, very interesting background. And not many hospital directors are hygiene and antibiotic stewardship experts. So this is a fantastic situation that we have here. And Elke will speak about the management during the COVID situation of a 650-bed hospital. It is in the south of Austria. And thank you very much for joining us, Elke, and the stage is yours.
Thank you, Bernhard. Thank you for the invitation and for the opportunity to share short impressions about the challenge of COVID-19 pandemic and the coping strategies in a public regional hospital. So Villach Regional Hospital is one of 5 province hospitals in Carinthia under the holding corporation of Carbeck. It's the second largest hospital in the area, and our task is to provide medical and nursing care for the region of Upper Carinthia. Some statistical data. You can see we have around 665 beds in our hospital and a total employees of nearby 1,500 employees. Yeah, and now COVID-19. First, on the 7th of January 2020, we all heard a novel coronavirus is reported called COVID-19 in China. So we looked to this part of the world and do not really imagine what happens in Europe. But then on the 22nd of February 2020, cluster increased in a northern region of Italy, Lombardy, and you can imagine Carinthia is the southern part of Austria and Villach is 25 kilometers far away from the Italian border. So we looked very anxious to this side of the border. And then we heard it from Walter Hasebeder. The first cases in Austria occurred, and at this time we start with our preparation. So first at all, because we are in anticipation of a disaster, so we started with really hard time. First at all with the Ministry of Health, like every part in Austria, in exchange of information, and then daily briefings with our state government and city government in expectation of many patients. Like in Italy, we all had the pictures in our head that we've seen every day what happens in Italy. And we implemented a task force and had also daily briefings inside house with our decision makers. Then we set up a separate entrances to separate the incoming patient with suspected infection. And this was really done in a short time, in 2 days. We had this separate entrance, and we had the help of all emergency organizations like the fire department. So we get tents, we get containers, always thinking about what will we do with the many patients we are expecting. Inside the house, we set up a new ward with an infection fluid so that we can separate these patients. And we create on our intranet, you have seen it just before by Walter Hasebeder, an information site so that our staff gets daily updated informations like information from the Ministry of Health or frequently asked question page or important telephone numbers and so on. It was daily updated, so everybody could imagine what happened in a moment. Really many times we invested in staff training, especially for these employees who worked in the COVID station, and it was to learn putting on and taking off protective clothes in the right way, and they trained and trained. And so we are really in the good situation that we had a less number of employees they got infected in the hospital. Then we hired a guard service and trained them in our process organizations and created, you have heard from Hans Herding, checklists like to handle with with infectious patients at the same time if they are coming in a great number. Or a very important checklist was our scoring list to detect which patient is to test, because at this time we had a less number of tests in our hospital, so we need this scoring list, and if the patient had numbered more than 3, it was our own scoring list. It's not evidence-based, but we do it in our best way, and if the patient got more than 3 points, we made the test. And other lists how to handle if there are more patients day per day. Yeah, and the next challenge was the protective gear. We must increase it, all the gloves, all the masks, and in the first time in March, it was really hard to get enough masks for our employees. And other side, the hand disinfections, we reported, you can see it's down on every 3 days how many is in the inventory, is it enough, because it's really a special critical supply. Then the lab was a central place with a lot of tasks, and this happens, you can see it on the left side, all the days that we get enough inventory. Yeah, and on the 11th of March, the WHO declared the pandemic disease, and since this time we detected every case in Carinthia, and you can see on the 16th of March there was the lockdown. Our hospital was closed like the other hospitals in Austria. I'm sorry, it was a little bit too fast. We increased the test strategy, and we got the help of the Federal Army, so we can protect our entrances, because we had a really problem. Our hospital is like a Swiss cheese with a lot of entrances, and so we need the help of the Federal Army to protect them. Yeah, this was the next challenge, the logistical challenge. If you have only less entrances opened, you meant a logistic challenge to bring the patient to the right place. And so we created route descriptions for the patients, but we also trained our careers because they had the new way to bring, for example, the samples in the lab, or our patient transport must know how to bring the patient to his examination or his treatment. Yeah, and then on the first case on the 24th of March arrived in our hospital, and then you can see in the next slices our datas, and here you can see from the data from the last year, and with all the preparation. You see that in Carinthia it was really a special situation. I think in Austria we had a less number of patients in the first wave. So you can see this, the yellow line, the COVID-19 patients, and the black line was the absence of the personnel. In March we had at this time at the peak 124 staffs absent because we divided the staffs in two groups, and always one group was at home and the other group in the hospital, because nobody knows at this time what happens with the infection, and we got many persons as contact persons group 1, so they had someone in the family who got infected. And you see, this was really a less number in the March. We are going through the summer, and then you can see it, the second wave. Here the situation changed totally, and in November we had 74 patients per week and 65 employees per week. They are not in order. On the gray line you can see the decrease and increase of our surgical procedures. And in the time from the March from 2020 until the beginning of March this year, we treated 738 patients, and we had deaths from 21%, and 43 patients going in another hospital because they need the ECMO and needed a higher level of ICU. On these two pictures you can see on the left side the age of the patients, and you can see that most of the patients are between 75 and 84. And on the right side is the length of stay with the mean time from 11.1 day. And on this you can see how really the situation changed and difference between the first wave in March 2020 and the second wave. Yeah, so I can see the real change for us was the second wave, and now we are prepared and hope we can imagine and manage the third wave. But in the moment, the really challenge is that we have a lot of patients they need a higher level of treatment, knowing because they are younger than the patient in March. And we have many, many post-COVID patients in-house. But we heard in the last presentation, we must thinking positive, and so we say that's not the end, and we don't forget to looking forward, and it's this way of thinking. We implemented a lot of strategies to increase the performance in hand hygiene. We measured our disinfection consumption, looked at the infection levels outside Corona, and with all these data, we apply for the Hand Hygiene Excellence Award 2021. Thank you for your attention.
So, thank you very much, Elke, for this hands-on report from a quite big hospital in the south of Austria, with all the specifics, with the proximity to Italy, with the preparations that you did with the first wave that did not hit you so severely, but with the second wave that hit you really severely. And it's very impressive how you immediately tackled the logistic question and the creation of route descriptions, so that you really get your people flow, the goods flow correct, and prevent infections. And still, despite all these fantastic measures, one has to acknowledge that 21% of the patients died in the intensive care unit, which is quite a lot.
Yeah.
And my question is, when you look to all these measures, one might think that with this fantastic, phenomenal increase in personal protective equipment, hand hygiene, everything, that the numbers of regular hospital infections would decrease, Clostridium and MRSA and all these others. Did you see that? Do you have data on that, or is that just a hypothesis?
Yes, Bernard, we have data about this, and we have seen it, and it's like your words is all the other infections are decreased. We have data about our surgical site infections. There's not so many difference, but like Clostridium, like influenza, we have the data, and they decreased. Yes.
That's amazing, and I mean, it's a disaster what we are facing, and we mentioned this in all the lectures. But if you look what you can conclude, what positive things you can conclude, it's probably the increase of awareness for hygiene, and it's probably the reduction of hospital-acquired or healthcare-associated infections that we are struggling with since many years. And if you confirm this, it's quite encouraging.
Yeah.
And secondly, maybe not everybody here knows, and we have quite a lot of listeners from many countries. There is an award from the WHO. This is the Hand Hygiene Excellence Award. And Elke and myself, we discussed about this a couple of years ago. And the point is that it's a fantastic program of the WHO. It's really fantastic, and it really helps to control their own safety processes and to improve the hygiene situation and the patient safety situation. And at the end, if you succeed, it's a very nice award that is given by the WHO. And so far, no single Austrian hospital has applied for this. And my congratulations to you and your team. You are the first hospital in Austria that has applied for this award, and we keep our fingers crossed that you win it at the end of the day.
Yeah. Thank you, Bernhard. Thank you for the nice words and for the explanation, because I thought that most of the participants of this Semmelweis Foundation knows knows what's about the hand hygiene excellence. I'm sorry for that I explained it not more. I'm sorry. But
no, I just wanted to put more light on it because you mentioned it in the last sentence of your presentation, and I want to give it I want to give it more spotlight, and this is really an achievement, and we will follow this closely, and we hope that you will get your inspection and that you win this award.
Okay, thank you. Thank you.
Thank you very much, Elke.
Bye.
Thanks a lot.
Bye.
Bye bye.